In terms of brain aging, now if my brain is aging, obviously the brain is connected to the whole of the body. Other parts of my body are going to be affected because of my aging brain, right? So we talked about the brain-gut axis. So what is happening to my gut, for instance?
So your metabolism changes as you age. There's no doubt about that. And that's one of the reasons why you find a lot of older people have constipation. Now, if you think about how health is thought about in ancient traditions, okay, it's not just about what you eat, it's about when you eat it, how you eat it, and how much of it you eat.
Right.
So there is definitely a preventive element, there is definitely a journey to wellness element which is built into that entire thinking process. And gut health is also affected by anxiety and stress. And people who are anxious and stressed out either have irritable bowels or constipation. And we see that all the time. In Ayurveda, there is the concept of Vayu. And Vayu affects not only your gut health, it affects your bone and joint health. So you get stiff joints, you get pain.
Right.
And when you talk to most older people, you will find that they have all these symptoms. Okay. So you came to me saying that I have been paralyzed from the time I had a stroke, or I have been forgetful, or I am having tremors. But when I look at the person beyond that, they have symptoms that affect various bodily parts. And we talked earlier about the autonomic nervous system. That also is part of your degenerating health, and that also will give you symptoms. So for example, people experience dryness of the skin as they get older. They experience chronic itching as they get older. Right? So a lot of this are signs that your autonomic nervous system is not functioning at its optimal anymore as well. So getting better needs to be holistic. Getting better needs to address beyond that paralysis, beyond that memory loss, beyond that anxiety, beyond that depression. It needs to address the gut, it needs to address the bone and joint, it needs to address the breathing, it needs to address the cardiac health. Mm-hmm. And one of the very nice things that we observe, we have people with diabetes and hypertension, long standing, come to us. And of course they've come to us because they have chronic disability of some kind. And we are not primarily working on their diabetes or hypertension, but as we work with them, the blood pressure starts to fall. The person who's on 4 antihypertensives has suddenly got low BP. So we say, look, let's take one of those away. And then we find that it's still low, then we take one more away. And we've had people go off from 4 antihypertensives to 1 in the time that they are in treatment. So there are indirect effects and benefits. The blood sugar starts to fall. I've had a lady who had an insulin pump put in, and with all that had an unbelievably high blood sugar when she came to us. We were working on her depression, we were working on her holistic health, and very interestingly, so this is a middle-aged person who was obese and who had many other problems, including a cardiac condition. Very interestingly, through that journey, her blood sugar came down from the 500s to about the 300s. In about 10 to 15 days. And her doctor, who was looking after her blood sugar, said, what are you doing? We've never been able to control it like this. And it is just that she was doing something different, which she had not tried before. So it's not magic, but I think when you follow a science, you will, which is different from the one that you've been exposed to till now, you will derive some benefits from that science. And that's what we see in a lot of our aging patients.